Hey, I'm here today to discuss frozen embryo transfer and then fresh embryo transfer cycles. Basically, once you have your embryos available and they've been cryopreserved, we thaw them out, the embryologist does, and he looks at them to see how many cells survived. In preparation for this cycle, what happens is we develop your uterine lining, either naturally in a natural cycle by doing an ovulation prediction kit, and when you get a surge, then we go in and do blood test and ultrasound, make sure the lining is sufficient, and start you on progesterone as a backup. And so that's a natural frozen cycle. A medicated cycle, we would use estrogen in some form, whether it's creams, injections, patches, or pills, and we prepare your lining in the first 11, 12, 13 days of your cycle with the estradiol. And then we'll do an ultrasound and blood test if everything looks good. Then we'll go ahead and start you on progesterone. Progesterone will start the lining converting so that we can determine the timing of when to transfer the embryos, when it's the most ideal time. At that point, from either type, then we'll start you on an antibiotic, which will help reduce any infection as we slide the catheter in the day of embryo transfer. And then typically, when we have you come back the 5th day or 6th day after starting progesterone, the embryologist will thaw out the embryos, he'll review them with you, let you know what survived the freeze-thaw process, how they look, and then I'll clean off the vagina and cervix with some medias, and then we'll slide a soft embryo transfer catheter right up inside the uterus, mid to upper portion, under ultrasound guidance with the 1 or 2 best embryos. Then we'll deposit those there, you'll rest in the office 20 minutes, go home bed rest that day and the next day. 10 days later, you can do a pregnancy test, a blood test, estradiol, progesterone, and beta-HCG. Once you're pregnant, 2.5 weeks later, we do an ultrasound, check fetal pull, heartbeat, make sure it's in the right place. And the risk of ectopic pregnancy nationwide and with us doing frozen embryo transfers is the same, basically less than 0.5%. Those are the risks. When we transfer the embryos are in a drop of fluid that has nutrients to help it survive. And the lining, the uterine cavity is not a wide open space or slippery slide. It's essentially flat front to back. And the inside lining actually looks like this on scanning microscopy. There's little fingers like the bottom of the ocean and little receptors, and the embryos attached there. So you don't have to worry when you stand up, go to the bathroom. The embryos aren't just going to fall out.